Emergency contraceptives are one of the most common drugs used by people, but there are a couple of options that people can choose from. So if you like to know something about emergency contraceptives, please watch this video where I will explain to you the different types, when to take them, and how to take them. So we have mainly two categories of emergency contraceptives. One is those ones you take through the mouth, so you take orally, and then there are those ones which can be put by health professional into your uterus, which we call intrauterine device, copper, specifically the copper, not the hormonal. So those are the ones which can be used for oral for emergency contraception. So the oral ones, they are also divided. There are two types mainly. So you have levonorgestrel, which sometimes we call the postinor, or emergency morning after pill. And then you have Ulipristal, which is sometimes called the Ella, the brand names. You can have Ella and others. So the postinor, you can take it 3 days, up to 3 days after sexual intercourse. But sometimes you can take up to 4 days, but most guidelines recommend 3 days, which is 72 hours after sexual intercourse. And then Ulipristal, which is the Ella, you can take it up to 5 days from the time of sexual intercourse. Let's start with the levonorgestrel, which is the postinor, which is the most common. But before we go to that, let's start with the incidences when you will need to take emergency contraception. So emergency contraception is only for emergencies, and you should not use it as your regular contraceptive. The cases where you have to take them is when you have unprotected sexual intercourse and you have not been on any contraceptive. So you take that emergency contraception to prevent pregnancy. But remember, our contraception doesn't prevent STDs, so always try to practice safe sex. Then the second is when sometimes people take the combined oral contraceptive pills, but then they miss maybe their dose and then they have a sexual intercourse. So if you have a missed dose for more than 24 hours, and then you will need to take emergency contraception to prevent pregnancy. Now, after understanding when you need to take emergency contraceptives, we go to how do you take these emergency contraceptives. The ones taken orally, you swallow them. You can take them anytime, but as soon as possible. And if you vomit within 3 hours of taking the oral contraceptive emergency pill, you need to take another one. Let's start with levonorgestrel, which is the postinor. So postinor usually comes as a single dose, but sometimes it can come in 2 separate doses, half. So you either take both of them or you take 12 hours, depending on the formulations. But usually comes as one dose, and then you take it only once. So what is the efficacy? How effective is it? So postinor, which levonorgestrel, is about 85% protective, meaning if you take it within 72 hours, the chance of not conceiving is 85%, meaning you still have 15% chance that you can conceive, and the effectiveness reduces with time. And also it can be affected by weight. So if you have your BMI is about 30, or if your weight is from above 70, it can affect the effectiveness, whereby sometimes you need to double the dose. And you can take postinor more than once in your menstrual cycle, so there's no limit of how many you can take. But as I said, do not use this as your contraceptive option. So this emergency pill usually prevents ovulation. So this is how it works to prevent emergency contraception. As I said, it can be affected by weight. And then the second thing is other drugs that you take, like some antibiotics can reduce the effectiveness of this postinor, and some drugs used for treating epilepsy or seizure medications can affect the concentration of this postinor. So either you might need to double the dose, or you have to get another alternative. And this postinor, you can take it even when you're breastfeeding. There's no problem. So let's go to the second one, the Ulipristal, which sometimes called the Ella. This one here, you can take it within 5 days of having sexual intercourse. And just like the postinor, if you vomit within 3 hours of taking this Ulipristal, you need to take another dose. It's also affected by weight. So if you are over 85 kilos, you may need to choose another emergency contraceptive option. This one, you cannot double the dose, but you can choose another alternative emergency contraception, either the postinor or the copper IUD as another alternative. And also this Ulipristal, you can take it even when you're breastfeeding. You can take it. If there's a worry of the concentration being higher in milk, so you can express the milk and discard it 24 hours after taking this Ulipristal. And Ulipristal, when you are taking it, you shouldn't have taken another contraceptive in the last 7 days, and you should not take another contraceptive 5 days after taking Ulipristal. It's more effective than postinor, but less effective than the copper IUD. Ulipristal emergency contraceptive can also be affected by other drugs. Now the last one is copper IUD. Copper IUD is more effective. It's like 99% effective, and you can use it up to 5 days. But the problem with it is it needs to be inserted by a health professional, and it's put in your uterus, and it prevents implantation. For copper, it doesn't interact with the other drugs you take, so you can have it even if you cannot take other contraceptive. The only contraindication there will come when you have active untreated PIDs, like infections down below. So in those cases, it's not recommended, and hence you have to choose another alternative. But overall, it's more effective than other emergency contraceptives. And another challenge with it is if you increase the small risk of ectopic pregnancy when you use copper IUD. Yeah, that's all about the emergency contraceptions available. If you have any questions about these emergency contraceptives, anything you want to know, please put it in the comment section, and please share this, subscribe to my YouTube channel. See you next time. This is Dr. Ice. Bye.